a 57-year-old man. November 2010, he had negative HBs antigen, negative anti-HBs. He was given a course of vaccination. And April 2011, which was about 6 months later, he was still negative after his full course of vaccination. He was given another booster, negative. Then the doctor decided to do a anti-HBC. This was positive. But then, after looking through all his notes, he has actually had this. He has seen doctors before. In November 2009, he was negative for both anti-HBs and HBs antigen. He was given a course of vaccination. A year later, he actually developed hepatitis B infection. This man could have not responded. He's 57, right? Number one scenario, he might not have responded to his vaccination for whatever reason. And then he developed acute hepatitis B infection. Or he could have been a hepatitis B chronic hepatitis B infection with a flare in August 2010. There's another case here. June 2009, negative for HBs antigen, anti-HBs positive. October 10, which more than a year afterwards, both negative. May 2011, both negative. So he decided to have a booster. After the booster dose, 1 month after the booster dose, still negative. But I deliberately cover his previous results for you. He was actually a carrier before. He had chronic hepatitis B infection before. He actually lost his S antigen. Right? He actually developed antibodies to hepatitis B. And then, the antibodies were not, or became negative again. Positive, negative, positive, negative. In the scenario that Wan Cheng was describing to you just now. So this person actually is not a vaccine failure. He is actually a chronic hepatitis B infection. Now, what are the factors associated with vaccination failure? Well, sometimes you can't tell because these people look normal. They are usually male, elderly, they're smokers, and most of the time it's genetic. The problem is genetic. Or it could be a technical problem. In other words, a very obese person, and instead of giving intramuscular injection, your needle is too short. Okay? So that is not technically, this is not vaccine failure. Then of course you can get vaccine failure in people with reduced immunology, like people in renal failure, chronic hepatitis C infection, immunosuppression. What do you do in vaccine failure? Remember, these patients have had 2 doses of vaccinations already, and it might be a good idea. For example, if after the first dose of after the first course of hepatitis B vaccination, if there's no response, you might want to change to another company's vaccine. Maybe if you started with MSD, do Havrix. Studies have shown that actually when you switch, if you look at number 2, up to 60% of them actually responded. Now, for those patients who have got immune deficiency like renal failure, you can double or triple the dose. For those who do not respond after second dose, you might want to give them repeated IM booster injections at short intervals. This is not a recommended procedure, but it does actually give them antibodies after a while. Now, number 4, combination of hepatitis A and hepatitis B vaccine, twin weeks. If you give them a vaccination with these 2, up to 95% of non-responders actually respond. Documented non-responders. It could be because the hepatitis A acts as a positive stimulator. We used to have vaccines with triple antigen, the S, the pre-S, and the pre-S2. This was actually also quite useful to patients who are non-responders. last time when we started experimenting with hepatitis B vaccine, way back in 1986, we have very seldom see patients with non-responders when we use a plasma-based vaccine. The plasma-based vaccine actually has got all these triple antigens in them. They're very strong immunogenic vaccines. They've withdrawn this from the market now because patients are worried that they might develop infections, occult infections of other viruses. I think we might get a triple antigen vaccine back soon in Singapore. Of course, you can try newer vaccines with better immunogenic potential, or you can try intradermal administration. They're helpful as well. So there are lots of different methods to try if you have got non-responder patients. What to do in vaccine failure if they do not respond to all what you've done? Avoid exposure, intravenous as well as sexual. And if they have exposure, give them post-exposure prophylaxis. Now, are they susceptible to infection, this vaccine failure? There have not been enough data to show that these people are more susceptible to infection. In fact, several placebo-controlled studies have actually shown that non-responders do get infection because their anti-HBs antigen later on found to be positive. Anti-HBC found to be positive as well. But how many of us specialists here have actually seen a non-responder who actually developed acute hepatitis B infection? I have not seen one. And in fact, there was only one case report of an acute hepatitis B infection described in patient who is a non-responder or a hyporesponder. So with that, thank you very much for your attention.